Roxithromycin is an antibiotic used to treat a variety of susceptible bacterial infections. In this video, let's found. What is roxithromycin? What is roxithromycin used for? Contraindication. What are the side effects of taking roxithromycin? How does roxithromycin work? How to use roxithromycin? What is roxithromycin? Roxithromycin is a semisynthetic macrolide antibiotic. It is used to treat respiratory tract, urinary, and soft tissue infections. Roxithromycin is derived from erythromycin, containing the same 14-membered lactone ring, but with an N-oxim side chain attached to the ring. Roxithromycin was patented in 1980 and approved for medical use in 1987. It is available under several brand names. Roxithromycin is available in Australia, France, Germany, Israel, South Korea, and New Zealand, but not in the United States. It has also been shown to possess antimalarial activity. What is roxithromycin used for? Used to treat respiratory tract, urinary, and soft tissue infections. Contraindication. Roxithromycin is contraindicated in the following conditions. Known hypersensitivity to macrolides, including erythromycin. Severely impaired hepatic function. Concomitant therapy with vasoconstrictive ergot alkaloids. Side effects. The most common side effects are gastrointestinal, diarrhea, nausea, abdominal pain, and vomiting. Less common side effects include central or peripheral nervous system events such as headaches, dizziness, vertigo. Rarely seen side effects are rashes, abnormal liver function values, and alteration in the senses of smell and taste. Pharmacodynamic. Roxithromycin has the following antibacterial spectrum in vitro: Streptococcus agalactiae, Streptococcus pneumoniae, Pneumococcus, Neisseria meningitidis, Meningococcus, Listeria monocytogenes, Mycoplasma pneumoniae, Chlamydia trachomatis, Ureaplasma ureolyticum, Legionella pneumophila, Helicobacter, Campylobacter, Gardnerella vaginalis, Bordetella pertussis, Moraxella cataralis, Brandhamella cataralis, and Haemophilus ducreyi. Roxithromycin is highly concentrated in polymorphonuclear leukocytes and macrophages, achieving intracellular concentrations greater than those outside the cell. Roxithromycin enhances the adhesive and chemotactic functions of these cells, which in the presence of infection produce phagocytosis and bacterial lysis. Roxithromycin also possesses intracellular bactericidal activity. Mechanism of action. Roxithromycin prevents bacterial growth by interfering with their protein synthesis. It binds to the 50S subunit of bacterial ribosomes and inhibits the translocation of peptides. Half-life. Terminal elimination half-life, 12 hours. Dose. The dose of this medicine will be different for different patients. Adults. The recommended dosage is 300 mg per day, which may be taken according to one of the following dosage regimens. Usual dosage: roxithromycin 300 mg tablets, 1 tablet daily. Roxithromycin 150 mg tablets, 1 tablet twice daily or 2 tablets once daily. For atypical pneumonia, the recommended dosage is 150 mg twice daily. The usual duration of treatment is 5 to 10 days, depending on the indication and clinical response. Streptococcal throat infections require at least 10 days of therapy. A small proportion of patients with non-gonococcal genital infections may require 20 days for complete cure. Safety advice. B1. Drugs which have been taken by only a limited number of pregnant women and women of childbearing age, without an increase in the frequency of malformation or other direct or indirect harmful effects on the human fetus having been observed. That's all the information about roxithromycin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.